Okay, in this video, let us look at sleep disorders. Now, sleep disorders, insomnia. Say insomnia.
Insomnia.
Okay, insomnia means insufficient sleep, or the person has lack of sleep, he is not able to sleep. Okay, for this you will suggest benzodiazepines. Okay, these are sleeping pills, right? If you give excess of this, the person will get addicted to it. So that is something else that you have to note. Benzodiazepines will be the treatment for insomnia. Okay. Now let us look at the next sleeping disorder, somnambulism. Okay. Somnambulism means this is actually sleepwalking. Sleepwalking. Okay. Sleepwalking, the person walks during sleep. This happens when in non-rapid eye movement sleep. That is when the muscles are actually, you can move, right? So that is when you have somnambulism. Fine. Next, narcolepsy. Narcolepsy means an irresistible urge to sleep during daytime. You want to sleep during the day, and this person suddenly goes into REM sleep. Okay. There is, as he goes into REM sleep, there will be loss of muscle tone also. Correct? So, sudden REM during daytime and loss of muscle tone, sudden loss of muscle tone, right? This is because of low levels of orexin, low levels of cerebrospinal fluid and such things, okay? But just remember, narcolepsy, the person gets sudden REM even during daytime and he loses muscle tone, okay? Then you have REM behavior disorder. Basically, in this, the person is in rapid eye movement stage and he is having nightmare or something. He responds physically during this. So, the muscle is able to respond, means there is no hypotonia which should have been there. In rapid eye movement, hypotonia should have been there, but there is no hypotonia and the person is able to physically respond during dreams. Okay. You can again manage this by giving benzodiazepines. Then you have sleep apnea. What is sleep apnea? Have you heard of it? Sleep apnea means the respiratory muscles actually stop functioning during sleep. That's very dangerous, right? Respiratory muscles stop. This is quite dangerous. So this person has to repeatedly, be awakened, okay? And he has to wake up, so that he can breathe. So at this time, what happens? The person will not be able to get REM sleep, fine, and he is deprived of sleep. Next is coma. Coma is a stage where basically there is some problem with the brain, and the person cannot be aroused even with painful stimuli. That is coma. Fine. That is coma, where the person cannot be aroused even by painful stimuli. There are a lot of reasons for this. Okay, you can look at them. There could be so many problems with the brain, damage to cerebral cortex, brain stem, or many things. Okay, infection of brain, etc. Now let us look at a last thing, brain death. Brain death is a condition where you declare the person as dead. The person cannot wake up again. Okay, that's very important for you to note. The person cannot function again. Okay, though other organs and are functioning properly, the brain death is considered as a criteria for death. There are several criteria by which you can pronounce a person as brain dead. The pupils could be unresponsive. I'm not saying that only this, but you have to check a lot of other factors. Pupils are unresponsive. What else? There is no breathing. Okay, if you remove ventilator support, the person cannot breathe, right? All such things will characterize as brain death. Fine. So these are the sleep disorders. Insomnia, very common, you will hear this, insomnia. Somnambulism, where the person walks in the sleep. Narcolepsy, where the person wants to sleep during the day. He is responding physically during rapid eye movement, that is REM behavior disorder. Then you have sleep apnea, where the respiratory muscles stop working. Coma, you cannot arouse the person with painful stimuli also. Brain death, where whatever you do, you cannot bring back the person. Okay, these are the sleep disorders.